The following segment is sponsored by Northern Nevada Health System.
We're here at the Northern Nevada Health System with AJ Flock, who is a wound care clinic manager, and we're talking about what conditions are commonly treated with wound care therapy. AJ, how are you, sir?
Good. How's it going?
Good. What are those conditions?
So a couple of things that we treat are wounds to lower extremity is really what we focus on. So those patients that are diabetic that have wounds that are struggling to heal, venous leg ulcers, pressure ulcers, and really any wound that hasn't fully healed or started to heal in about 3 weeks.
And you let the patient know that they need to have wound care therapy.
Typically what happens is they'll go see their primary care if one of these wounds are taking a while to heal, and they'll make sure they make the right referral, and they'll send it over to our wound care center, and we'll evaluate them from there.
Okay, big question here is, when would a patient require hyperbaric oxygen therapy? What is that, first of all?
So it's think of it as like an iron lung, but a reverse effect. So it's a big chamber that we actually can slide you in. It's clear. You can watch a movie, so it's relatively easy therapy. Some of the indications we treat are when one of those diabetic ulcers become infected. Sometimes if the bone gets infected, we can treat them in that chamber. Radiation injuries, so post-cancer treatment, as well as failed grafts or flaps.
And what are the benefits of, hyperbaric oxygen therapy, would you say?
Really, with those indications, the benefits is very rapid healing. But it does take those indications. It's not every wound that can go in there. It's those that are more, that we're focusing on limb salvage or critical limb salvage.
Got it. When it gets to that point.
Yeah.
And then how can a patient manage their wound at home? That'd be the opposite of the hyperbaric oxygen
right.
care.
So we kind of want to focus on some of the older methods that we have found recently in studies that aren't as effective as they used to be. We don't like hydrogen peroxide. We don't like Neosporin, maybe something like a bacitracin instead. And we don't want to soak in Epsom salt. So keeping it clean, keeping it covered, and then when those wounds don't heal in about 3 weeks, go see your primary care and come over to the wound care center.
And I'm guessing that when you talk about Neosporin or some of the other things that people have at home, that's pretty commonplace, right? So it's a misnomer that that's actually a good thing to use.
It can be. And it works on about 50% of patients, but we're finding that it can actually stall healing.
Interesting.
Mm-hmm.
Yeah. And the same goes with hydrogen peroxide?
Yeah, it can actually damage some of the healthy cells and prevent them from growing and healing.